One. Hi, guys, and welcome back to another episode of Crooked Illness. As you can see from today's title, we are going to be getting into the connection between genetics and addiction. Today's episode will be all about the relationship between these two things. Here to help me discuss this topic today is a very important guest. We have Dr. Kenneth Blum here, who is an American scientist who is considered to be the father of psychiatric genetics. He is trained at the Institute of Behavioral Genetics at Colorado University at Boulder. Dr. Blum received his PhD in neuropharmacology from New York Medical College and is a graduate from Columbia University and New Jersey College of Medicine. He has published over 550 peer-reviewed articles and written 17 books. In addition to this, he has been the recipient of many grants and awards, including a Lifetime Achievement in Addiction Medicine and the Presidential Award for Scientific Excellence. So without further ado, welcome Dr. Blum to the podcast.
Hello, everybody.
Thank you for being here.
My pleasure.
Yes, so excited to have you on today. So I really wanted to ask you this. So I know that you are considered to be the father of psychiatric genetics. So what inspired or interested you in getting into doing work in this field?
Well, I went to Columbia University and I got a degree in pharmaceutical sciences.
Mm-hmm.
Then I got a master's degree at New Jersey College of Medicine in medical sciences. And then I got a PhD in neuropharmacology. Then I worked for 4 years as a postdoctorate in the area of behavioral pharmacology. Then I went to Colorado University and did a special fellowship in genetics, but that was animal genetics. So, the entire scientific community from the late 60s all the way into 1990 were actually trying to find a genetic connection to addiction. But no one actually found that genetic connection. So in 1987, I decided to use a technique that was developed at Harvard. It's called restriction fragment length polymorphism.
Mm-hmm.
Sounds like a drift flip, we used to call it. And it sounds like a big word. But what it does, it allows you to go into the entire genome and pick out a particular gene that you want to associate with a disease. I don't want to go into all the details.
Yeah.
And seeing that, it was done in the field of Huntington's disease, not addiction or not mental health. But seeing that particular approach, I thought that might be a great way to find a gene connection for alcoholism. And at that time, I generated the interest of Dr. Ernest Noble, who's now deceased, who was a former director of the National Institutes of Alcoholism and Alcohol Abuse. We came together in my lab, we got a grant, and that generated the beginning of actually looking at a needle in a haystack.
Wow.
And that's what we did. And we happened to put together in 1989 a blueprint that we called the Brain Reward Cascade. So we designed with another individual from Southwestern Medical School in Dallas, Gerald Kalowski, a way of how the brain interacts into bringing about the proper amount of dopamine to be released to make you feel good in the reward center of the brain. So we put that all together, we had a blueprint. So we started out from gene to gene to gene to gene.
Yeah.
And we were fortunate that by the 8th trial, we found the first link, was the dopamine D2 receptor gene with the variant called A1.
Yeah.
And we did later studies to prove that if you carry that form, you have a 30 to 40% less dopamine D2 receptors in the brain, which is not a good thing.
Yeah, because I know a lot of the stuff because another thing you brought up when I talked to you before is about the deficiency in dopamine. I know that you were really looking at that and kind of making it your lifelong mission to help through your research design better treatment options for people suffering with various addictions, and really looking at that connection between genetics and addiction. And can you kind of talk about, because I know something that you coined the phrase, the term reward deficiency syndrome. So can you talk a little bit about what that is and the connection between that and the topic of genetics and addiction?
Okay. I try to say it to you with a little bit of a story. How's that?
Mm-hmm. Yeah, yeah.
And the story goes, when I was on a plane in 1995, I was going to give a talk in Bowling Green, Kentucky at the university. And I said to myself, and this was 5 years, 5 years after we found the dopamine connection genetically. And we did a lot of work after that. And a lot of people did a lot of work. And I said, what we see now is people going to meetings that have to do with endorphins, or meetings that have to do with serotonin or dopamine, or meetings that have to do with alcoholism, or meetings that have to do with opioids or cocaine. Everything is separated. And knowing since the 70s that our labs showed the initial connection between alcohol and opioids, we knew there was a common mechanism, a neurochemical mechanism. So when we looked at this, we said there got to be overlap. And what's good for one may be good for the other. There may be some specifics. But why don't we come up with a name that brings the entire field into one understanding of what people are going through? And if you know, there's substance abuse addiction and non-substance abuse addiction or behavioral addictions. So why is the gambler so different from the opioid addict? Or maybe there is not that much different. So we put the thing together, and I remember on the plane I was saying, is it reward deficiency? Is it reward hyperactivity? And I said, no, it's deficiency based on the genetics that we had from the past. So I called it reward deficiency. Then I thought about, well, what is it? And I thought about autoimmune deficiency syndrome, AIDS. And I said, there it is. Reward deficiency syndrome, which is an umbrella for impulsive, compulsive, and other kind of personality disorders linked together that leads the individual, because of low dopamine at the reward center, to reach out and seek either drug or non-drug behavioral addictions, including obesity. That's right.
Wow. Yeah. So kind of looking, so that term that you mentioned, the umbrella term that really includes all of these different addictions that we think about. So we think about gambling, alcoholism, drugs, whatever addiction we're thinking of.
Food addiction.
Yeah.
All of it. Shopping, hoarding.
Yeah.
We've been published on that. Nail biting.
Oh yeah. There's so many.
Trichinoma.
I know.
Skin picking, all of that.
Yeah. All of that is linked to low dopamine.
That's what we believe.
Low dopamine,
and it's not that we believe that. What you have to understand, Paris, is we did a lot of work from the 70s all the way to 2020.
Wow.
To show that.
Yeah, that all the research and everything kind of explains that. And you also have another term that I want to talk about that I looked at here. So can you talk a little bit about what the genetic addiction risk score is that you developed, and what does that measure?
Sure, it's called GARS.
Yeah.
Well, so what happened from 1990, when we did the original work with Energy Noble, into 2014. So we know that from work from many laboratories across the globe, that it just isn't the DRD2 gene that is going to be the only gene displayed in terms of reward deficiency syndrome, behavior, or addiction. There's many genes involved. In fact, there's an individual by the name of Lee who showed that there's a potential of 1,500 genes involved. okay?
Wow.
And then he reduced it to 393. And you keep getting it reduced and reduced. So we decided that we're gonna look at that blueprint that I told you,
Mm-hmm.
the brain reward cascade,
Mm-hmm.
and look at the major pathways in that system, and also the way the neurotransmitters are, in a sense, cleared
Mm.
from the synapse to either breaking down its molecular structure
Mm-hmm.
by enzymes, okay, or it's reabsorbed back into the pre-neuron. So we use all those major systems, the serotonergic system, the GABAergic system, the glutamatergic system, the dopaminergic system, and then the enzymes that destroy
Mm-hmm.
the dopamine or serotonin. It's called catechol-methyltransferase, monoamine oxidase in the mitochondria, and the transporter systems that take the dopamine or serotonin out of the synapse and puts it back into the pre-neuron to get reactivated. So we
Mm.
knew all of that. So the Gauss test
Mm-hmm.
has to do with genes and risk variations
Mm.
that if you're born with, bring about low dopamine release or low dopamine function, called hypodopaminergia. And the
Mm.
Gauss test is a test that is now available to Genus Health LLC, which is a company I'm a part of,
Mm-hmm.
that actually has brought the test commercially. So people can go ahead and utilize it, and we could determine the actual genes, no more guessing. Now, there's
Mm-hmm.
many other genes that may be involved, but for that test, we can determine the actual genes that cause low dopamine
Wow.
response and function. So
Yeah.
we could do it at birth, by the way. So we can
Wow.
tell at birth if your child has a tendency to get addicted. This is
Wow.
very important in pain clinics. You know, you take a 13 or 14-year-old to play soccer, they get a fracture. They go to a pain clinic, bang, they put them on high opioids. They don't
Mm.
know whether he could be addicted to high opioids.
Mm.
We can now know that. We can do the test, and you can say, well, this person has low, medium, high potential of being addicted to an opioid.
Wow.
And we can find that out. So this is a way of preventing even the opioid crisis, which is primarily due, quotes, the pain doctors would love me, but a lot of RX prescriptions, even though the
Mm-hmm.
pharmaceutical companies are saying, no, 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 that's not the reason.
Wow.
It has a lot to do with it.
So
So
that's
that's
amazing. So the GARS genetic addiction risk score that shows somebody the genes that are linked to low dopamine. So it actually
exactly.
identifies
There
the
may be
gene.
other ones. This is major ones. Okay,
Wow. Yeah.
it's
So
called
that
candidate genes.
yeah. So you can actually, and I know you mentioned at birth. So you can take a baby, and is it a blood test? What
No,
kind of a?
saliva. It's just a
Oh,
cheek cell.
saliva.
Yeah,
Okay.
cheek cell. Well,
Yeah,
cheek
that's
cell.
really cool because then you can see
Yeah,
the
it's
genes.
non-invasive.
Oh, okay, good. Yeah.
Non-invasive.
It's
Yeah,
good it's
that's
not
good.
invasive. Yeah, that's
Yeah,
yeah.
non-invasive. Yeah, no, and
Wow.
that's what's really good. And we think it has great utility as a prophylactic
Mm-hmm.
in terms of getting people onto high opioids. Now, in all due respect, the pain clinic docs are trying to do their best not to prescribe powerful opioids. But this
Mm-hmm.
is a way that we can help. It reduces the guessing and it makes it
Yeah.
objective.
Yeah, because I know you mentioned that to me before, is that, when someone gets injured,
Yeah,
they like really badly, or they have a major surgery, they're taking different medications that are supposed to help alleviate the pain. And then sometimes that person can get addicted to those medications or addicted to those substances
right.
that lead to issues with drug abuse. And
Yeah,
I know that that's something that you mentioned to me before too, and doing research on that and studying that, and also having this test, having this the GARS that you mentioned, that's a saliva test that you can take and actually see, here are the genes that I have that are linked with low dopamine and actually showing that to people.
And that could give the physician
Mm-hmm.
a kind of a upper power,
Mm-hmm.
so that he could, when he talks to an individual who may be in denial,
Mm-hmm.
and your father or your mother died in this hospital, you're
Mm-hmm.
doing the same thing. Oh, well, they're different. This gives the physician an upper hand to sit down, either a parent to sit down with the child, say, look, we got alcohol and drug abuse in our family. Here's what you test for. You got to be careful.
Mm-hmm.
And here are the reasons why you got to be careful. That really puts an individual in a different kind of box, because
Mm-hmm.
it makes that individual believe, because there's something that objective that they can look at, the
Mm-hmm.
DNA. And that helps in treatment plans, and it helps the individual to remove guilt, shame,
Mm-hmm.
remove denial, like any other disease, like diabetes. You got a problem. This is a molecular rearrangement of the brain. It has
Yeah.
nothing, a lot of it has to do, of course, with the environment. There's always 50-50,
Mm-hmm.
genetics and the environment. It doesn't mean that if you got this predisposition, you're going to become an addict.
Yeah.
That's not true. But the interaction with the environment, those two things, if you have the genetics and the
Mm-hmm.
environment isn't that good, you got a problem. You got to be careful.
Yeah.
So that is why this is so important, because the genetic addiction risk score absolutely can give an individual a better handle on what their brain looks like. It's a mirror into their brain.
Wow. Wow. Yeah, I know, because I know that's so helpful to know that there's something out there like that people can take advantage of and do this, the GAR saliva test, to see here are the genes that I have that are predisposed to low dopamine levels, and understanding that, because like you mentioned to me before, it is hard, especially if you're not in a good environment and you also have family history of substance abuse or things like that, then it is not good. It does become more challenging for that person at the time. So it's very helpful to have this available so the person can see what's going on with them, right? It's really good. So
Oh yeah, let me explain one more little thing, okay?
yeah.
The environment is not to be considered just an environment.
Mm-hmm.
The environment has what we call epigenetic influence on the expression of the genes. It don't change the DNA.
Mm-hmm.
It does interesting things to the messenger, the RNA, okay? That if it's a poor environment, you may get an inhibition of genetic expression. Positive environment, you may get an enhancement of expression. And these terms are called methylation and deacetylation. And, if anybody wants to know more, we can provide them with the information. It's detailed. But the good news is that you can also use that concept of epigenetics to repair the outcome of the DNA predisposition. That's a very important thing I like to discuss.
Wow. Yeah. So can you get into more of what epigenetics is? Just describe, what is epigenetics?
Epigenetics is a way that the environment can influence the expression of genes that are coded by DNA without affecting DNA. But it can go through one generation, 2 generations, I think up to 3 generations, without changing the DNA, but affecting the messenger RNA expression, which will be transferred from generation to generation to generation. So, for example, you have an individual who, when he grows up, he's abused by his father or mother. That abuse is an environmental epigenetic expression, which, by the way, may be able to go through 1 generation, 2, and 3. That's why fathers may abuse their kids, because they were abused. So it's not just will or free will. It has to do with changes of the genetics in terms of messenger RNA expression. So that's very important, that you have to understand how important the environment is. And therefore, one can use the environment to help affect the genetic predisposition. That's what I'd
Wow.
like to discuss.
Yeah, that's really powerful, using the environment to control the genetic predisposition, like you mentioned, because I know that you said, even though you could be born and have genes that are linked to addiction and different behaviors like that, that doesn't mean that you are going to become addicted or different things like that. I mean,
Exactly.
and that's a really powerful thing to talk about and get into, because I feel like it's it's a good message to communicate to people that just because you come from or you have genes that do have this predisposition for addiction,
Right.
alcoholism, or whatever thing like that, that doesn't mean that you are going to be that way as well.
Exactly.
Hmm.
Exactly. But you got to be careful.
Yeah. Yeah.
But the good news is, Paris, that we've also developed a solution that we believe is
Hmm.
very important to all of this. That's what I'd like to talk to you about.
Yeah. Tell us, what is it?
Okay. So over the years, from the beginning in the 1970s, by
Hmm.
1976, we found out that there was a natural supplement called D-phenylalanine,
Hmm.
which could inhibit the intake of alcohol in animals that are genetically prone to drink. Okay.
Wow.
Now, that all involves a very complicated system that has to do with the endogenous opioid peptides in your brain. It
Hmm.
increases those peptides in the brain that really allows you to get dopamine release. But I'm not going to go through all of that. Over the years, we have developed precursors to the neurotransmitters of the brain to balance the neurotransmitters if they're out of whack.
Wow.
Okay? And we found ways to inhibit the role of those enzymes like catechol methyltransferase, ammonium oxidase that destroy the neurotransmitters like dopamine in the brain. So what we've done over the years,
Hmm.
we have developed something called KB220 or KB220Z, and we now call it pro dopamine regulation.
Okay.
And this is very important because here's what we could do now. We could do the Gauss test. We can see what genes are being, let's say, dysfunctional.
Hmm.
And we can use this natural supplement, change the ingredients of the basic formula, okay, as a precision way of
Hmm.
surgically developing your own personalized medicine to
Wow.
fit your brain to balance dopamine, to bring about what we call dopamine homeostasis, which means dopamine balance, dopamine regulation, and
Hmm.
prevent low dopamine that leads to increased craving of all the RDS behaviors. And we think, and we've done it, by the way, we got many, many studies. There's 44 studies right now, clinical studies, double-blinded, triple-blinded, neuroimaging, all kinds of studies to
Wow.
prove that what we're doing seems correct. And John
Hmm.
Giordano was involved in some of the studies which we interviewed before.
Yes.
Yeah. Hello, John. And um, and the interesting thing is that we now have a precise way of fixing your brain and balancing your dopamine for you that relates to your Gauss test. You do the
Wow.
Gauss test, and that allows you to get a precision uh, dopamine balancer. And we think this is much better than what they're doing now
Hmm.
is using buprenorphine, methadone, antabuse, you know,
Hmm.
composite, all of which actually blocks dopamine in the long term.
Wow.
We got a way of naturally balancing it, making it easier for people to take, like a vitamin, no
Yeah.
side effects, free of side effects, and gives you a term of balance of dopamine. Of course, you got to take it every day,
Yeah.
but it's like a vitamin. It's like diabetes. You got to take the right medicine. This
Hmm.
is natural, and we got a precision. So it's called gauze generated therapy
Mm.
for dopamine regulation. That's what we do.
Okay. Yeah, that's incredible to hear about that and the work that you've done to make that a reality. So, if you could say what is the biggest lesson that you've learned through the clinical experience that you've gathered working to understand the connection between genetics and addiction?
The biggest lesson,
Mm-hmm.
the biggest lesson is that the field and the people that are involved with addiction medicine at the top level,
Mm-hmm.
even through the APA or whatever, seem to feel that the easiest way to deal with this problem of low dopamine is to bring about harm reduction. Is to just give the buprenorphine, give the methadone, and make the people sort of not relapse because they're on the same problem that started with the same thing, even with the composite, which is
Yeah.
things about low dopamine. So the biggest lesson is that the field has to realize, and I know Noah Volker personally, the
Mm-hmm.
director of NIDA. I know George Krug, the director of NIAAA. I published with Volker. The point of the matter is that everybody in the field is trying to find out a way how to either upregulate, downregulate, or balance dopamine. We believe we have something now that can help balance dopamine without going to buprenorphine and methadone,
Yeah.
drugs like that. And right now, naltrexone is a substance
Mm-hmm.
that is used to block craving only because of extinction and doesn't do anything but interferes with the dopamine response. So you don't get
Wow.
a high. But naltrexone, the compliance is terrible. We
Oh.
show in study that if you put naltrexone with the pro-dopamine regulator, the people that was just maintained on naltrexone after being on methadone 18 to 30 years, in 37 days relapsed.
Yeah.
When you put
Wow.
naltrexone with the pro-dopamine regulator, that went to 262 days. So
Wow.
by putting naltrexone, which could affect the outcome of craving for harm reduction, with the pro-dopamine regulator, you got to know another way of bringing about a better solution, especially
Yeah.
in the opioid crisis.
Yeah, because I know it kind of seems like one of the things that you mentioned too is like the biggest takeaway here is that the main focus of a lot of people is just to medicate the problem, right? So give them medications, here's to, take these medications and you'll be fine. But the issue with that is that, that could lead to addiction, that could lead to more problems, that could make things worse. So I like how you describe that and talk about that and really bring attention to that, and that a lot of people want to just prevent a relapse. We want to just focus on, make you good for right now, take the medications, go
Day
to
by
your
day.
doctors. Yeah, take it day by day. But I like how your approach is more of looking at the problem specific to the person, right? Because every person has different things that they are predisposed to. They have different things that they're dealing with, or, come from different environments. And I like how a lot of the stuff that you talk about and the work that you've done is more specific to treating that individual and then working with their genes and how that's linked to issues with addiction that they've been dealing with, instead of, just here's a pill, take it day by day. Don't, try not to relapse, try to do these things to stay on the right path. But I think that's really important. And it's a good message to get that out there, that, the stuff that you've done, and with developing this GARS test to actually identify genes, and especially, when you have a newborn, being able to identify, here are the genes that are linked to low dopamine. And then you also have this dopamine, the up dopamine regulator that you talked about, that could actually fix that.
Right, the balance.
Yes, and balance that out. And I think that's important, because you said something about, either you want to up dopamine, down dopamine, or balance it. And I think what you're doing is really great, and getting that message out there.
Yeah, no, I think that I think it has a lot of potential
Mm-hmm.
for the field, especially the people that that are in recovery and they need help.
Mm-hmm.
The idea is, you got AA and all the self-help groups, which is a
Mm-hmm.
good thing. It's a great thing, right?
Yeah.
But sometimes the people go there and their brain is imbalanced, either
Mm.
genetically or they've used drugs or whatever, or behaviors, and their brain is imbalanced. We're
Mm-hmm.
saying balance the brain, then you can deal with cognitive behavioral therapy,
Mm-hmm.
trauma therapy, all the things that can be used behaviorally to
Mm-hmm.
help you stay uh, in terms of recovery. Let you stay,
Mm-hmm.
instead of white knuckle, a little
Mm-hmm.
more relaxed, a little more happier, a little more able to balance yourself. And the
Yeah.
good news is that Genius Health has developed a system where you do the genetic test and then it tells you what particular product to take. So it's
Wow.
all done through a cheek cell test. It's really not
Yeah.
cheek cell test. It can be
Wow.
done at a very young age.
Yeah. So you take that test and it tells you which medications or which things to
Yeah, we
take that
have,
would.
what we've done is to make it easy, we've developed 6 um, genetically programmed, uh, semi-customized, we want to say, products that fit your particular neurotransmitter systems
Yeah.
or metabolism that is being affected to your genetics.
Wow. Wow. Yeah.
Yeah.
So, I mean, if you could tell me, or tell us just a little bit about the research that you've done to discover better treatment options for those suffering with various addictions.
Well, we've done a lot of work on alcoholism, okay,
Mm-hmm.
to actually first in developing the genetics of it, okay.
Mm-hmm.
We've done a lot of work on using this dopamine regulator over the years on alcohol craving and everything related to alcohol use disorder,
Mm-hmm.
including binge drinking. We actually showed in animals. We've done this work at Howard University with Marjorie Lewis's group at Howard University. We showed by using this dopamine regulator, we can actually reduce binge drinking
Wow.
in genetically better animals from males and females. You get a better response
Wow.
in females than males. We've done all that. We've done work on stress in humans, for example,
Mm-hmm.
where we use a galvanic skin resistance to give us an objective measure of stress. We looked at people that were either on alcohol or cocaine or opioids and went into treatment program, a residential treatment program.
Mm.
And
Yeah.
before they go in, they got detoxified, and the
Wow.
7th day they go into group. We measured the response of them going into group where they got very nervous, and we put a placebo, double-blinded, against the dopamine regulator in humans, and we looked at galvanic skin resistance to measure stress. We showed that the stress level goes completely down, very down.
Wow.
We've given them the dopamine regulator. We've done work with that. We've done work with neuroimaging studies in
Mm-hmm.
heroin addicts, abstinent, for say 2 years. And we put them on full dopamine regulation.
Yeah.
And we showed how the brain actually brought about balance
Wow.
in the area called the reward system. It's called
Mm-hmm.
the nucleus accumbens and the cerebellum. And we show, by the way, the cerebellum is very involved in craving behavior now. And we show that, for one, the nucleus accumbens now has the dopamine that can work.
Wow.
And when there's too much activity in the cerebellum, that's reduced. You show a beautiful way of bringing about balance in the brain. And I could go on and on and on.
Yeah. Well, I think that's
And
incredible
we
with,
done it with
yeah.
speaking, we've done opiates and heroin. We did it with cocaine. Okay.
Wow.
We've done it with benzodiazepines. We've done it with shopping, with hoarding, with food addiction.
Wow.
Just a variety of studies.
Wow. Well, I think that's so interesting that you've looked at all of those things and all of those things connecting to addiction, and you've been able to come up with this reward deficiency syndrome,
Exactly.
and then also link that to the GARS test where you can actually do that and then see, hey, like what genes do I have that might be predisposed to addiction, or what's going on with me. I like how the stuff that you've done, the work, the research, and everything that you've put together and put out there really helps people have a better understanding of addiction for them, right? For an individual. And I think that's awesome. And I'm so glad that you could come on here today and really share your experiences and share a little bit about the work that you've done and things like that, because I think this is it's a very important topic to understand that connection between our genes and addiction and how that works, what it looks like, what it means. And I'm just happy, that John could connect us so we could have this conversation. Yeah.
Now, one more thing that might be interesting to your viewers.
Yeah.
Right now, we're living in COVID-19.
Mm-hmm.
So social distancing is a double-edged sword, especially in recovery. People need to communicate with sponsors. They need to, the hug and the feel and the connection, the human spirit is missing. Okay.
Yeah.
And Laura Volker has put out a report recently, and she said, that certainly virtual interactions like Zooming with your family and the sponsors, it's all important. But here's the bad news. There's been an anecdotal report that between 30 and a 40% increase in opioid deaths.
Wow.
COVID-19.
Wow.
There's a big relapse problem. So there's a tremendous concern in the recovery field because of COVID-19 of the social distancing and the stress that is coming. Because when you get stressed, what happens? The dopamine goes down. If you're in labor as a woman, they measure this, that the dopamine is going down.
Wow.
Because you're in such stress.
Yeah.
But COVID is not a very good thing to have if you're in recovery. But what we're saying is that, hey, two things. One, you want to increase your immunity. Maybe your diet should help, right?
Yeah.
But in the pro-dopamine regulation, we got diphenylalanine. You know what that does? Raises the endorphins. You know what that does? Increases your immunity response. So not only does it reduce the chance of craving, it has an increase in bringing about an immunity response. So in COVID, it's really important, independent of what we're doing, independent of what I'm talking about, there's certain diet and some way of relieving stress, maybe through virtual interaction. Zooming and saying hello to your family and stuff like that could help. But all of this fits now with COVID-19, which we declare is going to be defeated somehow.
Yeah. Wow.
Probably with some drugs, vaccines, antibodies, whatever.
Yeah. Well, thank you for sharing that, because that's especially important right now, because we are living in this time. We are in the middle of a pandemic. We are in the middle of COVID-19. And I'm so happy that we could have this conversation. You could share all those tips, the advice, the work that you've done, and really it was great. It was great talking with you. It was great having the conversation we had before we did the interview. And I hope that you have a good birthday on Saturday, because I know you're 81 years old on Saturday.
I'm going to be with my family and some business people.
Well, I hope you have a good time. And it was great. It was really great talking to you. And I really look forward to putting this episode out.
Thank you so much.
All right. Bye. Yeah, of course. Bye, Dr. Blum.
Real sweet. Real nice meeting you.
Nice meeting you. Bye.
Bye.